Hi, welcome to Matka Medicine at www.matkamedicine.com. This is Bhavin Jankharia, a physician in practice for the last 35 years. Now, the premise of Matka Medicine is that we can control our health, lengthen our health span and lifespan, and be Atmasvast. That is, manage our health on our own with just a little help, if at all, from doctors in the healthcare system, and you'll find everything else on the website. Now, it's been about 8 months since I started Matka Medicine last December and added the concept of Atmasvast halfway through as a way to live long healthy. And while there's still a lot of ground to cover, I thought today on Independence Day, it's time to take stock of what it entails to have a long health span and a healthy lifespan. So today's topic is titled The 13-Point Atmasvast Guide to Living Long Healthy. And while these 13 points may seem overwhelming, well, you can't simplify it too much. This is what living long healthy entails. I mean, most of us grow up believing that our health is not ours to manage, but should be left to experts like doctors in the healthcare system, which is fine when you're sick and ill, but of absolutely no help when you want to be free from disease. I mean, we know more about our cars than we do about our own bodies and health, and that's just weird. So it needs to change. So here are the 13 points. The first and the most important is move, physical activity. And I can't repeat that statement again, right? That if physical activity was a pill, it would be the most prescribed and taken pill in the world. But anyway, we need 150 to 300 minutes of moderate physical exercise or activity per week, or it comes to 500 to 1000 meds per week. So you can walk or run, do strength training, mix it all up, add some high intensity training at least once a week, whatever works. That it doesn't matter, um, but something needs to be done, preferably every day. The second is eat smart, eat less. I used to use the term eat sensibly, but I think this phrase is even better. Eat smart, eat less. So, within that, calories should be in check and less than or around 2000 per day, with 5 portions of fruits and vegetables per day, plant-based eating as much as possible. So, of course, it doesn't mean that you don't have your meat and fish if you are a meat fish eater, but the predominant food has to be plant-based. Avoid all ultra-processed foods, anything that comes in a packet, and individual superfoods as a major component of the food that you eat, right? And then some forms of fasting or calorie restriction, either time restricted or intermittent fasting or whatever, um, either daily or once or twice a week goes a long way. The third is manage your cardiovascular risk, including hypertension and diabetes. So you should learn how to measure your own risk using calculators at least once a year and get one CT calcium score study done after the age of 45. The low density lipoprotein or LDL should be less than or equal to 100 milligrams per deciliter and less than 70 if there is any risk factor. The blood pressure should be 130 by 80 millimeters of mercury or less, and definitely below 140 by 90. The HbA1c should be less than 5.6 with a fasting blood sugar less than 100 milligram per deciliter. Now, for these 3 points, if the values are abnormal, and if physical activity and eating sensibly do not bring them to normal, then you need medication. I mean, there are no two things about it. And then that's the time you need to consult an appropriate doctor. Make sure there's an ECG done every year, especially above the age of 65, to pick up conditions like atrial fibrillation. The fourth point is to sleep well. And I haven't yet written about sleep, but you need between 7 to 9 hours a day. And if you snore or are sleepy or groggy during the day, you need to see a sleep specialist to make sure that all that is sorted out. The fifth is to address deficiencies and take supplements. And especially in India, we need adequate proteins, which should be at least zero point 0.5 to zero point 0.8 milligrams per kg body weight. So if you weigh about 70 kilos, then you need to take at least about 60 grams or 55 grams of protein, per day. And if your food doesn't provide this, then supplements should be used. Uh, Vitamin D supplementation is needed, and so we can take vitamin D3 sachets at least once a month. You get a 60,000 international unit sachet for about 10 to 20 rupees, like one of those pan parag sachets. Just take one once a month. Vitamin B12 supplementation is needed for vegans and Jains, and you need to ask your doc once as to how much to take. And then other supplements like omega-3, etc., would be based on your individual situation. And I will write about this more as we go along. The sixth is to take vaccines, and I've written in detail about this above the age of 50. Protect yourself from COVID-19, the flu, pneumococcal pneumonia, varicella zoster, and DTP. And in the future, we're likely to have vaccines for TB, dengue, and malaria. They should be taken as and when available. Seventh, improve balance. Do not fall and do not fracture if you fall. And the most important thing for this is physical activity, as in the first point. With this, we can add some balancing exercises with yoga or Tai Chi as part of our daily, weekly physical activity routine. Eighth is to screen for cancers where screening has been validated. So that means yearly mammography for all women above the age of 45 years, um, lung cancer screening with low dose CT scan if you smoke or have been a smoker yearly or once in 2 years, depending on the amount of smoking. Pap smear for cervical cancer every 5 years till the age of 65. Stool for blood for colorectal cancer. In India, colonoscopy is not yet advocated for routine screening. Physical examination once a year to look for lumps and bumps. And more importantly, do not screen for other cancers unless you're specifically genetically at high risk. For example, if you have the BRCA genes that I wrote about in my post on genomics, in which case your oncologist will guide you. Ninth is to maintain good hygiene, including dental, vision, hearing, and time. So, oral hygiene matters. And I talked about how bad gums cause increased blood pressure a few weeks ago. So, see a dentist at least once in 2 years and on your own. I mean, make sure that you brush and floss if needed, and keep your mouth clean. Vision matters, good hearing is important. Make sure you see an ophthalmologist at least once in 2 years for cataract and macular degeneration. And if you can't hear well, use whatever are the most current hearing aids that would help you do that. Use your time wisely, right? Time hygiene is equally important. Tenth is to prevent cognitive decline. Again, physical activity and eating smart and less are the two things that help with preventing cognitive decline, but also keep the mind active with reading or mind puzzles. None of these have been proven per se to arrest cognitive decline, but an active mind is always good to have. Meditate. A stable mind actually helps reduce cardiovascular and other risks. 11th, reduce, control, or eliminate addiction. So drink alcohol sensibly if you have to, otherwise, don't. With smoking, there are no two things, just stop, period. And control caffeine intake. And I think I'm going to write about this next Sunday, as to how it's the biggest addictive drug that we are currently on worldwide. But definitely no caffeine in any form, at least 4 hours prior to bedtime. That's a must. 12th, reduce the pollution in our lives. So air pollution in whichever way possible, including if you live in a significantly polluted area, change your residence or migrate if that is an option. Noise pollution. Use earphones when traveling, but not when walking or driving, obviously. And don't make noise. Don't create noise. Don't honk when you're driving, right? And digital pollution. Reduce dramatically the use of gadgets and the time spent on social media, unless that's your profession. Most of what we see on Twitter or Facebook or WhatsApp is just noise, and effectively, I call it pollution. And you have to actively manage all of this, right? Sign out of all the WhatsApp groups, for example, that only send flowers and good mornings that are of no relevance otherwise. Block people who send you posts unnecessarily. All of that needs to be done. And lastly, 13th, and this is something that I will be writing about in much more detail in the months to come, is manage the logistics of your health like you would manage any other major long-term project. First of all, within that, make sure you have enough money to last till the age of 90 years, inclusive of catastrophic spending at least once in that time span. So remember that if you fall sick and you need to be hospitalized or have major surgery, you could be spending a good amount of money, anywhere between 10 lakhs to a crore, depending on what you have. Apart from the money that you need every month to spend on your food and physical activity, and if required, your visual and hearing aids, etc. So you need to have good financial planning, and we'll talk about that. Get good health insurance up to the maximum amount you can afford for yourself and the family. Identify a health coach who can guide you through points 1 and 12. Now, we don't have enough of these, but I think as the time passes by, we will have people who are not doctors but can help with non medication related advice and hand holding, right? Also, identify a good physician, preferably a family physician you can reach out to when sick, who can guide you through the process of meeting other specialists, navigating hospitals, making sense of different reports. I mean, for example, if you have a problem with the lungs and the kidneys and the heart, you will see a pulmonologist, a nephrologist, and a cardiologist, but neither of these three will talk to each other. So you need one physician who takes the responsibility of putting all this together. And sometimes the three will give you advice that is contradictory. So who's going to do that? Somebody needs to do that. Sometimes, if you have a very smart caregiver, child, or spouse, or friend, they can also do that. It's not rocket science, but you need to be able to do that. And ideally, the best people are the family physicians. If you are lucky to know a good geriatric doctor, and we don't have them in India at this point in time, but they are there abroad, please see them once a year or once in 2 years, because they're trained to identify problems and guide and help. Lastly, get a health checkup every year based on points 1 and 12. Don't do anything more than is required, but at least get all of this done. But manage all of this as much as you can on your own. Remember, in India, you don't really need prescriptions for getting blood tests done, so you can just do them on your own. So remember, this is a dynamic guide which will change over the months and years with additions and subtractions as our understanding of how to live long, healthy advances and improves. But until then, this is, if you want even a dogmatic 13-point guide to living long, healthy, then this is it. I mean, and this is what needs to be followed. And I will again say, it's not simple. It's not like you can create a dummy's guide or a 101 or whatever. You can't dumb down your body. It's not that easy. You can't make up these funny, flowery aphorisms and sayings that would propagate virally. The body is complex. There are things we need to know, and we need to take that responsibility on our own. And I don't know why I would keep saying this again and again. No one else is going to take care of your health. The only one who's going to do that is you, right? Anyway, have a good Sunday. Happy Independence Day if you're Indian or living in India, etc. And in case you know anyone who would benefit from reading this, especially above the age of 45, 50, please do share. I think it would help. All right. Take care. Bye bye. See you next Sunday.